Hello, everyone. Thank you for joining today's presentation. My name's Luke Ferrari, and we're going to be getting into some peptides for cognitive and neurological support. Before I do, I have to be very clear in that I am here representing myself and Kaizen Innovations, and the goal is really to stimulate your interest in peptides for research purposes. We're going to be reviewing clinical data. I will share my personal experience, but please note I am not endorsing or promoting any specific company or brand outside of that context. The content is intended. Hey, babe, I'm on a webinar right now. Okay. Gina, my daughter is going to join us for a second. So I'm here. I want to clarify that this is the presentation for educational purposes only. I am not providing any medical advice, diagnosis, or treatment recommendations. Sorry about that, everybody. Um, this information is not intended to be considered marketing, promotional, or legal advice. Many of these compounds, basically all these compounds that we're discussing today, are not FDA approved, and they are designated and designed for research use only. So I am not liable for this information, how it's interpreted or applied outside of an educational context. My goal is to simply share general knowledge, emerging research, not to direct clinical care. So I encourage everyone to view the content through the lens of individual judgment and regulatory guidelines. Now that that's out of the way. Okay, so today we are going to be covering peptides and compounds for cognitive and neurological support. It's quite a big topic, and so I'm going to try to speed right along so we can cover everything. What we're going to be covering is kind of an intro to the specific products or compounds, the mechanism of action, as well as in some cases, I've realized that I can provide dosing protocols. Recently, I know that that's been a big request from a lot of individuals, and it's been a real shortcoming of these presentations. But I recently did a deep dive into how that I can do that, and what I've determined is that I can relay dosing information if it's coming from a respected source. Luckily, I do a lot of reading. I've got a bunch of books, and so hopefully that is extra beneficial for those of you today interested in specific dosing. So we'll be talking about some classics like Selank, Semax, Tesofensine, as well as some new products, specifically Brain Ultra. And so excited to get into that. So this really is just to, again, it's to stimulate your interest in peptides, spread awareness, as a lot of these tools may support clarity, memory, resistance, resilience to stress, even brain health. So, cognitive decline is a huge issue. I'm sure probably everybody on this call knows someone who has been affected by cognitive decline, right? So brain fog, stress-related impairment are among some of the most common concerns in the world today. From professionals struggling to focus, could be due to aging or even just pressure. And really, what do traditional approaches often rely on? Oftentimes, it's stimulants or medications, which have their own often unwanted side effects. For example, everybody knows stimulants, Adderall, uh, Ritalin, etc. These can create oxidative stress. And so peptides and the related compounds that we're going to talk about today represent what I think is a new category of support. They're really designed to work with the body's own signaling pathways, potentially promoting clarity, memory, resistance to stress, even potentially neuroplasticity in some situations. So this presentation is going to explore all those products that we had discussed, and we're going to jump into it. So old classics, Selank. So as we've discussed, cognitive decline, brain fog, stress-related impairment, these are all major issues in the world today. And so it's often seen in professionals under pressure, students, even aging populations. So as I mentioned earlier, high dose stimulates can often have a lot of negative impacts, including physiological stress, sleep disruption, elevated heart rate, blood pressure, even oxidative stress. Where Selank potentially could fit in the future and in current research is part of a new category of support. It really works by using the natural signaling pathways. It's kind of a calms the system while preserving clarity. And so essentially you have a calming impact without the sedation that comes with a lot of current drugs. Additionally, it potentially could support focus, memory, neuroplasticity through the BDNF activity. This is brain-derived neurotrophic factor. Additionally, there's information to suggest that it supports the immune modulation by helping balance inflammation and brain resilience. So really, the way I think of Selank is that it can be thought of as kind of like a calm focus tool, potentially useful when it comes to stress and anxiety, um, potentially even improving cognition. So this is one of my favorite products. I've used it consistently. And when I was reading about it, it really fits in my experience that it has a kind of a calming focus, almost like Adderall without the any jitteriness or adverse adverse implications. A little bit more about the mechanism of action. So Selank is often described as providing a calm focus, as we discussed, lowering anxiety without sedation. And the way that it works is it influences the GABA system. GABA system is essentially acts kind of like a brake pedal for the nervous system. So providing it's essentially your calming pathway. So it slows overactive signals, which reduce stress and tension. By balancing GABA, Selank helps to people really feel more stable under pressure while remaining sharp. So research shows that Selank can support memory formation and promote long-term neuron health. So the result is a blend of emotional stability, mental clarity, which makes it different from traditional anti-anxiety drugs that kind of blunt that cognition. So, as I mentioned, I've figured out a way that I can compliantly provide dosing protocols, which I think is going to be very beneficial as it's a common complaint that I get from these presentations, to be honest. And so these protocols are drawn from published clinical references, most notably from James Laval, his book, Peptide Handbook, A Professional's Guide to Peptide Therapeutics, and the International Peptide Society. And so their recommendation is subcutaneous injections, typically anywhere from 250 to 500 micrograms, given 2 to 3 times per week. Now, dosing is always adjusted to patient goals and response. Safety profile is very positive, generally well tolerated. Most combinations include essentially the same thing that any injection can provide, irritation at the injection site. It has very few systemic side effects been reported. Again, these are not FDA approved in North America and considered experimental research use only. Cmax. So Selank and Cmax often go hand in hand. Cmax is a neuroprotective peptide, again, one of my favorites, that supports multiple aspects of brain health. So it's really known to enhance working memory, essentially helps you hold on and manipulate information during complex tasks. So it's reported that it can potentially help speed up learning and integration of new information. I don't know about you, but in my role, learning about all this science and everything, that is a huge, huge benefit. I need to be speaking with researchers and physicians as regularly as I do. I need to be on point. Can't sound like a caveman. So it plays a role in nerve repair and recovery, especially after oxidative damage or neurological stress, which is interesting to me because we know that stimulants create oxidative damage. So a question that I don't have an answer to is, would using Cmax in combination with a stimulant like Adderall or Ritalin be a benefit to the patient? I don't know. Just kind of a question to throw out there. Key feature is that strongly influences brain-derived neurotropic factor, BDNF, which is often called fertilizer for the brain. So BDNF supports neuron growth, maintenance, and repair. So Cmax rapidly increases BDNF, explaining its effect on memory and resilience. So it has been clinically explored for ADHD symptoms and as well as post-stroke rehabilitation. It's also relevant that researchers believe that it sharpens cognition and stress resilience. So in short, Cmax potentially can help protect the brain, promote recovery, and enhance cognitive performance by boosting brain-derived neurotropic factor. So Cmax really works on the neurotransmitter system, right? So it works specifically through dopamine and serotonin. These systems have been known to impact attention, motivation, mood, overall balance without overstimulating. So, as we discussed, it boosts brain-derived neurotropic factor, which is going to help protect, potentially even grow neurons and form new connections as well as repair them. It has been shown to help reduce oxidative stress, which is, cell damage and from free radicals, potentially even supporting healthier mitochondria and keep neurons functioning under stress. Again, there is an improvement additionally when it comes to the immune system, contributes to high recovery from injury, high stress events. In simple terms, Cmax works on neurotransmitters, growth factors, stress pathways. So together, these can help explain how it can benefit memory, learning, recovery, and resilience. Dosing protocols. Okay, so again, this information comes directly from published reference guides, specifically Peptide Handbook, our man, our boy, Dr. James Laval, love that guy, as well as it was printed through the International Peptide Society. So for sub-Q injection, the suggested dosage range is 300 to 1,000 micrograms or zero point 0.3 to 1 milligram per dose. It can be given daily or even twice daily, but guidance notes that frequent use may lead to desensitization, right? So basically, majority of peptides out there, we don't want to be on them forever. We want to use them cyclically, and this is no exception. So indications described in the literature include neuroprotection, cognitive support, anxiety, chronic stress support, recovery following hypoxic or neurological events such as TIA, stroke, traumatic brain injury. Safety profile very well tolerated. Most report mild side effects, uh, mild and localized side effects, including redness, irritation, potentially joint or muscle discomfort. Compared to Selank, Cmax can be sometimes feel a little bit more sedating. I've used both of these peptides, and I have not felt the sedative component at all. So again, not FDA approved here in North America and intended for research. Okay, so Brain Ultra 7. This is essentially brand new. It is proprietary formulation unique to the manufacturer. It is a oral dropper, which means it's not labeled as research only. You can see the breakdown. It's got 60 milligrams of NAD plus. I won't bore you by reading through everything. But essentially, this is a nutritional supplement, right? So it's not intended to diagnose, treat, cure, prevent disease, educational use only. So it is a multi-dose oral dropper designed for sublingual use. So the dosing protocols that we're going to talk about are not professional guidance. I'm not sure if the compliance issue is an issue because it is considered a nutritional supplement. So we're just going to run with it. And again, this is a very unique product. When I was doing my research, I couldn't find anything about it. I don't think there's really any case studies or peer-reviewed information about it, but the manufacturer's perspective is that there is a significant synergy and across these included products that basically span a complementary pathway, right? So NAD, which everybody should know, is studied for cellular support, energy and support. Selank and Cmax, the idea being it will promote calm and focus and brain signaling. BDNF and Dihexa, these have been explored in adaptability and neuroplasticity. Alpha GPC, Huberzine A, may support learning and memory process. Oxytocin, studied for stress modulation and social balance. Again, I haven't used this product, but the products that I have used that include oxytocin, I really enjoyed. I think I ended up calling somebody I hadn't spoken to in a long time and telling them I love them. So that's always good. Oxytocin, it's kind of like the love hormone. Um, so the intention of this is really a multi-pathway support rather than a single target approach. So potential benefits may help with clarity, may help with concentration, may support short and long-term memory processes, may promote stress balance and resilience, may contribute to overall mental performance. So really, this was designed with kind of a busy professional, student, or just aging population in mind that want clarity and resistance in their day to day. So we've kind of talked about this now at nauseum, but uh, mechanism of action, again, it's not really widely studied, but we know that all of these separate components, NAD, alpha GPC, oxytocin, C-Lank, C-Max, BDNF, dihexa, all play a beneficial role. And so essentially, each ingredient has been studied for its potential benefit for brain health. And taken all together, the idea is to provide a broad support for clarity, adaptability, and resilience. So this is dosing suggestion and frequency. The suggestion would be zero point 0.2, excuse me, zero point 0.2 to zero point 0.5 ml taken once or twice daily. Always recommended anytime you're taking a new supplement to start at the lower end and adjust as needed. Again, it is sublingual. It's an oral dropper. These methods allow for very fast uptake under the tongue as opposed to oral capsules. So everything should be done in cycles. This is no exception. Suggestion would be 5 days on, 2 days off, and this will help maintain responsiveness over time. Um, Additionally, a cycle of 4 to 12 weeks would be the suggestion. Length can vary depending on goals and individual response. ARA 290. This is a very interesting peptide as well as all these peptides are, right? So ARA 290, it essentially works it's essentially gives you the benefits in some regards to EPO and in terms of its potential to build and keep nerve. And so and the tissue protective effects of nerve of EPO. So it leaves out the parts that increase, it leaves out the parts of EPO that increase red blood cell production. So you're not going to get that hyper endurance that was popularized by the cyclist in the 90s, Armstrong. But you also avoid the blood thickening risks. So, research indicates it may support nerve health and repair. It's being studied for its role in reducing neuropathic pain and inflammation, which is very difficult to treat. It's investigated conditions related to neuropathy, even diabetic macular edema, as well as chronic inflammatory states. Some people call this peptide smart repair peptide. Instead of just blunting pain signals, it may actually help reset the body's repair pathways. So, how does it work? Mechanism of action. So, it binds to IRR, which is innate repair receptors, and it activates repair pathways. Does not stimulate red blood cell production, unlike EPO. Additionally, it may help calm inflammation at its source, support tissue recovery rather than masking the pain. Some studies indicate that it's currently being studied for small fiber regrowth, may help explain observed improvements in neuropathic pain. Additionally, a very interesting component is that it lasts, meaning the repair signals that you're creating with this peptide can persist even after clearance. So even after the peptide is gone, those repair systems may be remaining open. Think of it almost like switching on a repair program, right? So again, it's being investigated for neuropathic pain, diabetic eye disease, as well as inflammatory issues. So common thread, like kind of what you can think about, it's kind of dialing down inflammation while engaging repair pathways. And it's very unique in that it's potentially going to improve nerve damage and injury because there's not a lot of products that are that focused. So, dosing protocol. Again, these are the guidelines that I found using the peptide handbook, James Laval, International Peptide Society. This is not medical advice, but so typically all the majority of these products in terms of research setting are going to be lyophilized, so you would reconstitute it, and then the administration is going to be 4 milligrams subcutaneous injection given anywhere from 3 to 5 times per week. Apparently, in research, they emphasize for best outcomes, consistency is very important, and the typical course is 4 to 5 weeks. It's reported to have a very low adverse event reporting system, or excuse me, very low adverse events reported, and very clean safety record in the studies. Again, it does not raise red blood cell counts or carry the same clotting risks that EPO covers, not FDA approved. And then lastly, it's being studied for chronic conditions and inflammatory diseases. I don't have any personal experience with ARI 290. Dihexa. Dihexa is really interesting. It's also going to be in a tablet form, so we can consider this a nutritional supplement. Dihexa is promising nootropic compound, and it is going to be it's currently being studied for brain health and function, described as a very small, highly potent, and it's often noted for brain penetration in research discussion. So it's so small and potent it can actually pass the blood-brain barrier. It's being looked at for cognitive enhancement, specifically around potential support for cognitive function, memory formation, and retrieval. Additionally, there's information to support its benefits for neurodegenerative issues. Research is exploring use in context of cognitive decline, neurodegeneration disorders, as well as focus and mental clarity. Evidence is evolving. Obviously, I'm not making any claims. Not FDA approved. Okay, so how does it work? Dihexa has been studied for its interactions with HGF, hepatocyte growth factor, and its receptor. So this connection is linked to the pathway that may support cell repair and neural health. Research suggests dihexa may be helpful when it comes to synaptogenesis, the formation of new connections between neurons. So stronger networks may support learning, memory, and adaptability. And really, the idea is by fostering these new connections, Dihexa is able to potentially enhance brain plasticity. Plasticity is really key when it comes to the brain's ability to adapt and reorganize over time. Additional studies indicate Dihexa may help support survival and growth of neurons. This has led to interest in possible role in long-term brain health. So dihexa, again, it's considered a nutritional supplement as it is in a tablet. It remains experimental, not FDA approved. You might get tired of me hearing me say that, but I'm going to keep saying it. Um, when it comes to dosing protocols, All praise to the Peptide Handbook and James Laval and the International Peptide Society for providing this information, educational only, not medical advice. Suggested dosing would be 10 to 40 milligrams orally daily. Dosing is typically individualized based on goals and context. Um, it may support memory, focus, mental performance. It's being explored in research involving cognitive decline, neurodegenerative conditions such as Alzheimer's and Parkinson's, excuse me. Generally reported to be very well tolerated. Most common issues reported include nervousness and irritability, which sounds like me on a daily basis. So what's the difference? Again, not FDA approved. Moving right along, tesofensine. So tesofensine was originally investigated for neurodegenerative conditions, Parkinson's, Alzheimer's diseases, but during studies, researchers observed unexpected metabolic and weight-related effects. So you've got the cognitive potential as well as potentially a weight loss impact. May help increase dopamine availability, which is linked, dopamine obviously is linked to drive, motivation, reward response. I think, yeah, I think that's probably what the same pathway that the um, Adderall and Ritalin work on. So it's thought to improve alertness, mental stamina by influencing norepinephrine pathways. So research has shown potential for enhancing executive function, planning, switching tasks, completing complex operations. Clinical studies noted weight reduction in participants, often accompanied by fat loss and muscle preservation. There's also signs that it would have improvements on insulin sensitivity, metabolic health, other potential impacts may improve mood, even cravings, and emotional eating. Compared to the traditional appetite suppressants, early data suggests it may be better tolerated with fewer side effects. Care should be taken anytime we're dealing with anything dealing with the with SSR patients or individuals utilizing SSRIs as that reuptake inhibitor. If that's already being utilized, might not be a great idea for those individuals. So tesofensine is being explored for neurological and the added potential benefit of weight loss and metabolic health. Again, it was first investigated for Parkinson's and Alzheimer's. Later research revealed broader effects, again, cognition, motivation, metabolism, even. I think that was a pretty surprising. And the way it works is it is a triple monoamine reuptake inhibitor. So dopamine is going to impact and enhance motivation, reward pathway. Norepinephrine thought to increase alertness and attention. Serotonin may help mood and emotional regulation. So really by acting on all three of these pathways at once, tesofensine potentially could create a multimodal effect. So this sets it apart from single target cognitive enhancers. Again, because it works on the serotonin pathway, caution is advised with anybody using any products like SSRIs, selective serotonin reuptake inhibitors. In simple terms, tesofensine may help motivation, focus, mood, energy, which it's all being explored under research purposes, not FDA approved. So, NAD, BDNF, and alpha GPC. So, this is a manufacturer's proprietary blend. And again, anytime you're talking about proprietary blend, we don't have all the information, right? This isn't widely used, very rare in this space. And so their reasoning for it is as follows. NAD plus, great for energy and DNA maintenance. BDNF in a peptide form, great for plasticity and connection and strength. Alpha GPC uh, has been shown promising for learning, memory processes. So the intent, obviously, not to treat or diagnose. I don't have dosing protocols for this. This is a lyophilized peptide that is reconstituted. Happy to connect with individuals offline to talk about it more. And then lastly, the idea behind this product is going to be around exploring cognitive fatigue, post-stress recovery, and healthy aging. This is something I've used and I like it a lot. I don't really know how to describe it other than when I use this product, I'm focused and really kind of dialed in, for lack of a better word. Okay, so again, it's a unique combination of products, right? So I don't have a ton of clinical data on it. But the systemic effects we've kind of already covered, um, from NAD, BDNF, alpha GPC. Manufacturer's reasoning of the combination really covers three complementary pathways. So I like it. I'll say that. We've also covered growth hormone secretagogues kind of at length. I feel like at one point I was talking about it every single webinar. But so I won't go into a ton of detail, but growth hormone is, very important. It's kind of an all-encompassing umbrella hormone similar to testosterone. At least that's the way I personally think about it. And so peptides like CJC 1295, tesamorelin, ipamorelin, they don't just build the body, but rather they build up the brain function as well. They stimulate growth hormone and IGF-1 which has been well documented to promote neurogenesis, better mood, sharper memory, especially in growth hormone deficient adults, especially when sleep and recovery are so important. It's really like the basis of health in my perspective, because that is the time you're able to recover. So growth hormone secretagogues have huge benefits and potential significance when it comes to neurological and cognitive support. And kind of already talked about that. Summary and major takeaways. So, key takeaways, I think, I hope you take away from this just a synopsis of what we talked about. Selank and Cmax, potential benefit for kind of a calm focus, memory support without stimulant or like the drawbacks of benzos that help people relax. I have used these products and I like them a lot. I don't know how to describe it other than I am better equipped to deal with stress and I just feel like I'm switched on. Like there's no moment wasted when I use Cmax and C-Link. NAD, alpha GPC and BDNF, cellular energy, flexibility of brain adaptation. I have not used those products. Dihexa and ARA, emerging strategies for synaptic repair and nerve health. From a practical standpoint, in blends, these kind of unique blends, specifically Brain Ultra or NADBNF, alpha GPC, simply approach the body with a multi-pathway support. And so really the idea would be to improve or potentially look at research for brain fog, fatigue, stress-related impairment. These are not cures or replacements, but emerging tools, right, for supporting clarity, resilience, and daily performance. And with that, we'll move on to, again, this is not intended, you're just for attending my webinars, as you've probably already figured out, there's no certification, there's no stamp, there's no letters behind my name. And so really the goal and the intent has always been just to stimulate interest, stimulate research, and kind of get these products out into the zeitgeist. And so obviously my webinars are not going to be enough. And so in terms of education, it's critical that providers and researchers take this really seriously and do their own due diligence. And so when it comes to educational platforms and protocols, I like a few websites, peptideprotocols.io. It's a paid website. It includes peptide education protocols, even marketing resources, which I think are really helpful. Um, Peptide University is also good. It's also a paid website. It is cheaper, but when it's cheaper, you also get less, obviously. And then my favorite books include Peptide Handbook, A Professional's Guide to Therapeutic Peptides, Dr. James Laval. Key detail is, Judah, if you can add a link in the chat where people can find this book. It's kind of hard to find on Amazon. One link will tell you that it's out of print. And then lastly, Dr. Seed's Peptide Protocols, another book I highly recommend. Really, if you are diving into peptide research, it's completely on you to educate yourself as much as possible. So if there's no more questions, I will give you back your time. Again, I really appreciate everyone joining. I do really hope that this is beneficial and impactful. And feel free to reach out to me directly if you'd like to discuss these details further. Thanks, everybody.